Maxim, a life-changing product. Proper care and handling of the Maxim scleral lens is very important for successful wear. The following video is a complete care and handling guide for such wear. First and foremost, the lens should be cleaned daily and stored in solution for nightly disinfection. We recommend that the lens be cleaned at removal. When cleaning the lens, place the lens in the palm of your hand. Instill a few drops of gas-permeable lens cleaner. Rub the lens in a circular motion with your index finger for 15 seconds. Rinse thoroughly with water. Store your lens overnight in a deep well case filled with preserved saline. Prior to insertion, the lens should be removed from the case and rinsed with fresh saline. It is very important when inserting the Maxim lens that it be placed onto the cornea without any unwanted bubbles being trapped under the lens. In order to do this, first it is imperative that you fill the concave surface of the lens fully with non-preserved saline. Second, your head must be in a downward gazing position. This will assure that the lens can be brought up onto the cornea without having to tip it, thus allowing the saline to remain in its concave surface. Because the lens is a little clumsy when filled with saline, it is almost impossible to insert this lens by placing it onto one finger. However, there are two ways to hold the lens while inserting. One method is to use a two-finger technique. Place the lens in between your index and middle finger. Then fill fully with saline. For your right eye, use your right hand to hold the lens. For your left eye, use your left hand. Pull down on your lower lid with your ring finger. Pull up your upper lid with your middle and index finger of your other hand. Bring the lens onto the cornea, making sure you do not spill any of the saline from the lens. Release the lower lid, then the upper lid. Once the lens is placed onto the cornea, it is important to check for any unwanted bubbles. They usually can be seen by looking into a mirror. However, if focusing for near is a problem, a 10x magnified mirror will help. If an unwanted bubble is trapped under the lens, it should be removed, re-cleaned, and reinserted. A second way to insert a Maxim scleral lens is with a contact lens insertion tool. Place the lens onto the concave surface of the tool. Fill the lens with unpreserved saline. When inserting your right lens, use your left hand to hold the tool and your right hand to open your eyelids. When inserting your left lens, use your right hand to hold the tool and your left hand to open your eyelids. When opening the lids, place your thumb on the lower lid margin and place your index finger on the upper lid margin. Spread the lids apart, opening the eye as much as possible. Bring the lens up onto the cornea, making sure not to tip it. Once in place, check for unwanted bubbles. Removing the Maxim scleral lens is easily done with a suction cup. However, after all-day wear, the Maxim scleral lens will have settled onto the cornea and will be somewhat snug. Because of this, it is important to loosen the lens prior to removal. We recommend that you irrigate the eye with saline and physically move the lens back and forth with your index finger. This technique allows the lens to loosen, thus releasing freely from the eye. After the lens is loosened, we recommend using a suction cup for removal. First, wet the tip of the suction cup with saline. Second, and most importantly, make sure to attach the suction cup to the nasal or lower edge of the lens. Once attached, rock the lens back and forth while pulling the lens off of the eye. Ask your Accu-Lens representative for information on our in-office demonstration of the Maxim scleral lens. You are only a phone call away from making a difference in someone's life.